My name is Henrik Husu. Thank you for the opportunity to present our work regarding infectious complications in severe acute pancreatitis. There are no relevant conflicts of interest regarding this study. Infectious drawbacks might complicate the disease course in severe acute pancreatitis. Infected pancreatic necrosis correlates with existence of organ failure, is associated with increased morbidity, need for invasive interventions, and increased mortality. Effect of prophylactic antibiotics in acute pancreatitis has not been shown in previous studies. Number of patients with severe acute pancreatitis is, however, quite low in these individual studies. We wanted to study the incidence, risk factors, and consequences of infections in patients treated at an ICU at a high-volume unit. In this retrospective cohort, all patients suffered from persistent organ failure. In fact, around 60% had multiple organ failure. Treatment protocol included a short course of second-generation cephalosporins at the time of admission to ICU. More than half of all patients suffered from some type of infection. Infected pancreatic necrosis, occurring at a median of 3 to 4 weeks from disease onset, was the most common infection. Pneumonia and bacteremia generally occurred within the first week and presented in 10 to 15% of patients. We conducted a multivariate analysis of pre-specified clinically relevant risk factors for infected pancreatic necrosis. Independent risk factors were severe acute pancreatitis following ERCP or an operation, wider spread of necrotic collections compared to centrally located necrotic collections, pre-existing psychiatric comorbidities, and preceding open abdomen treatment. In conclusion, despite short prophylactic antibiotics, more than half of patients with severe acute pancreatitis develop some type of infection. Infected pancreatic necrosis is the most common infection. Post-interventional etiology, widely spread necrotic collections, the preceding existence of psychiatric comorbidities, and preceding open abdomen treatment were for the first time identified as risk factors of infected pancreatic necrosis. Thank you very much for your time. Feel free to send me any questions regarding our work.